All right, happy Friday. Allison here. Wanted to talk to you guys today. This is the third, is it the third one? The third topic on the gut today, and I wanted to talk to you about what leaky gut is. So we've kind of touched on what the gut does. We touched on the gut microbiome. And so this is kind of what happens when our gut microbiome gets out of balance and something called leaky gut happens. So this is a true issue that can occur. Probably some of us have it to some degree. So we talked about gut killers from last video. So what that leads to is, since most of our immune system is in the gut, and our gut wall is our biggest protector between us and the external environment. So when you have things that affect the gut lining and cause something called intestinal permeability, you have these kind of tight junctions in the wall of your gut. And so with taking things and eating things and doing things that cause that intestinal lining to kind of get permeable, meaning there's little holes that can occur in the lining, then you have things like bacteria, food particles that escape into our bloodstream. And so this can really cause a low level of inflammation in our body all the time. And we know that chronic inflammation can lead to disease, like heart disease and other types of diseases. Chronic inflammation can also contribute to mental health and things like that. And so it also is going to set off your immune system. So then your immune system is going after these things that it normally wouldn't do. And so that's why leaky gut can also be linked to autoimmune problems. And autoimmune can be anything from allergies to asthma to skin disorders. There's a lot of contributing factors of leaky gut to mental health. So things like brain fog, some depression, anxiety, things like that. Not saying that's the only cause, but I know for my anxiety, it was really directly tied to my gut health. Once I addressed that, then my anxiety got better. So that was awesome. So mental health, skin health, digestive health. You don't have to have digestive issues per se to have leaky gut problems. But you could have things like irritable bowel. There's also always other kinds of autoimmune bowel disorders that people can get. It can contribute to low stomach acid and heartburn, things like that. And then also, other autoimmune things that you can think of, which, there's lots of different types of autoimmune disorders people have, but I've even read about leaky gut being linked to things like autism and Parkinson's and MS, just a whole slew of different things. Not to say that that's the only cause, but that can definitely contribute. So you have to think about when you're dealing with something, even if it's just a symptom like being really tired or brain fog or some anxiety or skin rashes or even acne or allergies, you have to kind of think, could this be coming from my gut? So one doctor that is kind of termed the leaky gut guru his name is Alessio Fasano. I think it's Alessio Fasano. Maybe it's two. Anyway, Alessio Fasano. So he's kind of the leaky gut doctor that kind of has been one of the doctors who kind of coined the term and has a lot of research behind it. So you can actually test to see if you have leaky gut. I think there's a blood test you can do where you look for something called zonulin. We don't really test for that, but you go off symptoms and then you start to kind of work on removing things that are triggering the leaky gut. So, candida overgrowth can contribute, but most of the time it's the things we talked about in the last video that affect our gut in a negative way, and just chronically over time of being exposed to things and having these changes in our gut lining, then that's going to cause leaky gut symptoms down the road. So if you look at your history, and looking back at mine, it makes sense that I had leaky gut. It makes sense that I ended up getting Hashimoto's, which is an autoimmune thyroid condition. And I really believe a lot of my issues that I had for, probably 10 years or so that kind of just got worse and worse and worse over time were directly related to that. And so when you look at my history, I was a sick kid for some reason. I had lots of infections. I was on lots of different antibiotics. I had this asthmatic bronchitis that was crazy, even though my allergy tested were pretty much normal. And then as a teenager, I had acne, and the treatment was antibiotics. So I want to count how many I was on, but I was probably on lots and lots of antibiotics before I was even 20. And I did a nasty drug called Accutane when I was 17 for acne. Didn't even realize it was a chemo drug, but it is. And so, and then 2 years later I get cancer, and I have to think, I'm not saying it was related, but I have to think that something that was going on growing up contributed to that, because why would someone that's 20 get a lymphoma, which is a lymphatic cancer? So anyway, from all the research I've done, I really think there's a big relation. And if, our bodies were not designed to get cancer, our bodies were not designed to fail, they were designed to heal. It's just all these things that have occurred in our environment, in medications and things like that we're doing that we maybe don't even realize that we're doing, are contributing to the leaky gut issues. So that's what I want to talk about. Leaky gut is a real thing. Look it up yourself. Look up Alessio Fasano. Read about it. You'll probably find a whole list of symptoms that you can probably relate to. I know I did. I had several. So get to the root cause, look at the gut, treat the gut. Next video, I want to talk about things that we can do to start healing our gut and to start feeling better. So thanks for joining me on St. Patrick's Day. Hope you guys are wearing green. Got some green on here. So you guys have a good weekend. Thanks.